Chairman, we are ready to begin.
Thank you, Denisha. And would you please call the roll of the board members?
Yes, Chairman. Norman Boyd,
Here.
Tommy Hopkins,
Here.
Cynthia Rucker. Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley,
Here.
Robert Coles.
Here.
Chairman, that concludes my roll call.
Thank you, Denisha. That's 100% attendance by the board members. So we have a quorum to conduct business. We welcome all of you to the meeting this morning. We have an extensive agenda and we will move right into that. We have to consider this morning for votes 8 items for final adoption, 7 for initial adoption, some consideration of rate changes in the state health benefit plan. We'll get a legislative update. And we thank the department for providing materials for the meeting in advance. So we've had an opportunity to look at the items we're going to be discussing this morning. With that, I'll move into the first agenda item. I'll call the meeting to order and then move into the first agenda item, which is the minutes of the previous meeting, the April 11 meeting, and ask if Dr. Ruckers had a chance as our secretary to review those minutes and would recommend that they be approved.
Good morning, Chairman Board. I have reviewed the minutes from April the 11th, and I find them to be in order, and I recommend they be approved as stands.
Recommending those minutes be approved. Is there a second to that?
Second, Williamson.
Second, Hopkins.
The motion has been seconded. All in favor say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved, and thank you very much, Dr. Rucker. Next on the agenda, I'll call on Commissioner Carlson for the commissioner's report.
All right, thank you, Mr. Chairman. When we have a full agenda, I'll be brief. I want to thank all of our DCH board members for joining us today, as well as members, interested parties in the public watching or listening virtually today. As full an agenda as I've seen in my time here, Mr. Chairman, as you'd imagine, every item on here reflects a great deal of preparation and research and attention to detail on the part of our team. As well as a long-standing, active and productive dialogue with partners and stakeholders. And coming on the heels of session, much of this was done with the support of colleagues at sister agencies, OPB analysts, legislative staff, and legislators themselves, obviously. Many items today being introduced were covered in some form or fashion with legislative action that was signed into law by Governor Kemp, and some items from the Appropriations Act signed just this Monday. Many items, specifically those our colleague Brian Dowd will present regarding waiver services. These represent a multiple year effort of multi-agency stakeholder engagement and negotiation. Others, like the directed payment program proposals brought forth by Mr. Lipton, are complex financial models with implications for hospital funding in literally every zip code of the state. So knowing we have a full plate, Mr. Chairman, I'd like to close with a special thank you to Kelly Johnson and the entire HR team for their work in organizing a robust week of activities around Public Employee Recognition Week. I want to thank all the team members who continue to participate throughout the week. A lot of positive energy towards volunteerism, education, yoga, trivia, and an awards program here in this very room. So very grateful to all those that organized and attended. And I think that's a good segue into to recognize some employee milestones. A couple of big ones too. I'd like to kick it off with 3 of our team members that are celebrating their 25th year with the state of Georgia. Dolores Cooper in HFRD, Sana Alexander in Financial Management, and Victoria Montez in Inspector General, all with 25 years of service to the state. Susan Elcock, Inspector General's Office with 15 years. Nita Ham with the State Office of Rural Health with 10 years. Stacy Young with HFRD, 5 years. Tanisha Smith with Financial Management, 5 years. Calvin Chaplin, Inspector General, 5 years. James Barber with the Board of Healthcare Workforce, 5 years. And Rachel Lamone with 1 year here in Financial Management. So grateful for everyone, especially 25-year milestones. That's really something. We're very grateful for their continued service. And with that, Mr. Chairman, I'll hand it over to our very full agenda.
Thank you, Commissioner. Are there any questions or comments for the Commissioner from the board, please? Hearing none, we will move into the first item for consideration today and being asked to vote on final adoption. Kim Morris, Director of Reimbursement, will present the nursing home patient-driven payment model.
Good morning, Chairman Boyd, members of the board, and Commissioner Carlson. Today, I'm presenting for final adoption, pending Medicare and Medicaid services acceptance, a proposal to replace the current Resource Utilization Group RUG-based resident classification system with the patient-driven payment model PDPM-based resident classification system effective July 1, 2024. Total funds to implement this change is $71,264,248 with state funds of $24,308,235. An opportunity for public comments was held on April 17th, 2024 at 11:30 a.m. and written comments were due on or before April 24th, 2024. There were no public comments and one written comment from Donna Nackers, Vice President of Reimbursement, Georgia Healthcare Association, GHCA source. The commenter appreciated the education and calculated shadow rate information provided by the department. The commenter expressed concerns with the department only using the nursing home component of PDPM. The department thanked the commenter for her written comment in support. The department will consider for future review any information the association brings forward. At this time, I'll pause for any questions from the board and ask the board for final adoption to update to the PDPM-based resident classification system effective July 1, 2024.
Questions, comments from the board, please, for Kim? Hearing none, is there a motion for approval for final adoption?
Dr. Lee, motion to approve.
So the motion has been made for approval. Is there a second?
Second, Hopkins.
It has been seconded. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much.
Thank you.
Moving to the next item, and there are several here under Brian Dowd, our Deputy Executive Director of Policy and Compliance in the medical assistance plans. So Brian, you may proceed with your first item.
Thank you, Mr. Chairman, Commissioner, and members of the board. My first item up for final adoption is approval of the rate increases for the Georgia Pediatric Program. Effective July 1st, 2024, DCH proposes to increase rates of reimbursement for pediatric in-home skilled nursing and personal support services in accordance with the 2024 Georgia legislative budget and in line with equitable services as indicated by rate study for the home and community-based waivers. An opportunity for public comment was held April 18th, 2024 at 11:30, Written comments were received on or before April 25th, 2024. DCH received no oral comments. DCH received one written comment from Dave Lamb, the legislative chair of the Home Care Association of America, Georgia chapter. Mr. Lamb, on behalf of himself and the members he represents, expressed full support of the rate increases. He further expressed appreciation for starting the process early to align with the July 1st, 2024 start date. DCH thanks Mr. Lamb and the association for their written comment support. I'll pause now for any questions and would respectfully request consideration for a final adoption, the proposed rate increase for the Georgia Pediatric Program.
Questions, comments from the board, please, for Brian? Hearing none, is there a motion for approval for final adoption?
Shane
Also-
Mobley motions.
The motion has been made for final adoption approval. Is there a second?
Second, Dr. Rucker.
Dr. Rucker has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much, and you may move on.
My second item up for final adoption is approval of the proposed waiver amendment for the Independent Care Waiver Program. Effective July 1st, 2024, DCH proposes to amend the ICWP waiver to enact the results of the 2023 rate study for providers. This is pending CMS approval of the waiver amendment. The amendment will meet requirements as outlined by the 2024 Georgia legislative budget and the 2022 Senate Bill 610 requiring rate studies to be conducted on the waivers. An opportunity for public comment was held on March 18th, 2024 at 1 p.m. Written comments were received on or before April 15th, 2024. DCH received no oral comments. We received one written comment from Dave Lamb, the legislative chair of Home Care Association of America, Georgia chapter. Mr. Lamb, on behalf of himself and his members he represents, expressed full support for the waiver amendment. He further commented that the rate increase will help to address the current workforce shortages within the waiver community. DCH thanks Mr. Lamb and the association for their written comment and support. I will pause for any questions and would respectfully request consideration for final adoption of the waiver amendment for ICWP.
Questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Also
motion for approval, Mr. Chairman.
Second, Hopkins.
Dr. Hopkins had made the motion for approval. Is there a second?
Shane Mobley second.
There is a second motion for approval. Is all in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much, and you may move to your next item.
My third item up for final adoption is approval of the proposed waiver amendment for the Elderly and Disabled Waiver Program. Again, effective July 1st, 2024, DCH proposes to amend the Elderly and Disabled Waiver Program to enact the results of the 2023 rate study. The amendment will meet requirements as outlined by the 2024 Georgia legislative budget and the 2022 Senate Bill 610. An opportunity for public comment was held on March 20th, 2024 at 11:30 a.m. Written comments were received on or before April 15th, 2024. DCH received no oral comments. DCH received 3 written comments. The written comments were from Dave Lamb, legislative chair of the Home Care Association of America, Georgia chapter, Lori Sims, director of government relations with CareForth, and Donna Knackers, the vice president of reimbursement with the Georgia Healthcare Association. All 3 commenters expressed full support of the waiver amendment. They commented that the amendment and associated rate increases will help address current workforce shortage issues. DCH thanks all commenters and the associations for their written comments and support. I'll pause now for any questions and will request consideration for final adoption of the waiver amendment for the elderly and disabled waiver program.
Questions or comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Folsom, second.
Roger Folsom has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, you may move on to your next item.
My fourth item up for final adoption is approval of the proposed waiver amendment for the new options waiver program. Effective July 1st, 2024, DCH proposes to amend the now waiver to enact the results of the 2023 and 2022 rate study for providers. The amendment again will meet requirements as outlined in the 2024 Georgia legislative budget and the Senate Bill 610 from 2022. In addition to those rate increases within now, DCH will be proposing for CMS approval to establish wage caps on the wage paid to self-directed staff, providing community living support, community access individual, and respite effective April 1st, 2025. Self-directed staff will be able to pay paid up to the rate consistent with corresponding agency rates. An opportunity for public comment was held March 20th, 2024 at 1 p.m. Written comments were received on or before April 15th, 2024. DCH received one oral comment from Darcy Robb, the Executive Director of Georgia Council on Developmental Disabilities. Ms. Robb, on behalf of GCDD, offered support for the waiver amendment. Ms. Robb noted the increase in wage assumption for direct service professionals is particularly important. DCH thanks the commenter for her written comments and support. DCH additionally received 3 written comments. The comments were from Robin Garrett, the Executive Director of the Georgia Association of Community Service Boards, Heather Rosner, of the Chief Executive Officer of Bridge Health, and a joint response from Dr. Aaron Vinosky Thomas at the Center for Leadership in Disability at Georgia State University, Ruby Moore from the Georgia Advocacy Office, and Darcy Robb, the Executive Director of the Georgia Council on Developmental Disabilities, along with Dr. Zolinda Stoneman from the Institute on Human Development and Disability at the University of Georgia. All written commenters were in support of the waiver amendment and rate adjustment. The joint commenters also commented the incentivization of day services within the community and ending lifeline limits to specific services outlined in the public notice. DCH thanks the commenters and the associations for their written comment and support. I'll pause now for any questions and will respectfully request consideration for a final adoption of the now amendment.
Comments or questions from the board, please? Hearing none, is there a motion for a final adoption approval?
So move, Hopkins.
It has been moved that the be approved for final adoption. Is there a second?
Dr. Lee seconds.
There is a second for that motion. All in favor, say aye.
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 Aye. Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, you may
Thank you.
move ahead. Thank you.
My 5th item up for final adoption is approval of the proposed waiver amendment for the Comprehensive Supports Waiver Program, or COMP. Effective July 1st, 2024, DCH proposes to amend the COMP waiver to enact the results of the 2022 and 2023 rate study. Additionally, the waiver amendment will establish wage caps on the wages paid to self-directed staff, similar to the now waiver we just discussed. This amendment will also add a self-direction model to supported employment services. Again, this amendment meets the requirements as outlined in the 2024 Georgia legislative budget and the 2022 Senate Bill 610. An opportunity for public comment was held March 27th, 2024 at 11 a.m. Written comments were received on or before April 15th, 2024. DCH received one oral comment from Darcy Robb, the Executive Director of Georgia Council on Developmental Disabilities. Ms. Robb, on behalf of GCDD, offered support for the waiver amendment. She noted the increase in wage assumption for direct service professionals is particularly important. She also applauded the elimination of some lifetime limits to specified services that we have outlined in the waiver. DCH thanks the commenter for her written comments and support. There were 4 written comments received. Those comments were for Robin Garrett, the Executive Director of the Georgia Association of Community Service Boards, Heather Rosnier, the Chief Executive Officer of Bridge Health, Cynthia Levi, the Chief Executive Officer of Avita Community Partners, and again, a joint response from Dr. Aaron Vanowski Thomas from the Center for Leadership and Disability at Georgia State University, Ruby Moore from the Georgia Advocacy Office, and Darcy Robb from the Executive Director from GCDD, and Dr. Zelinda Stoneman from the Institute on Human Development and Disability at the University of Georgia. All commenters were in support of the waiver amendment and rate adjustment. The joint commenters also commended the incentivization of day services within the community and ending of lifetime limits to specific services outlined in the public notice. DCH thanks the commenters and the associations for their written comment and support. I'll pause now for any questions and would ask for consideration for final adoption, the amendment to the comp waiver.
Questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Folsom, motion for approval, Mr. Chairman.
Roger Folsom has made the motion for final adoption. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, you may move to your next item.
My 6th item up for final adoption is approval of a proposed waiver amendment, again, to the Comprehensive Supports Waiver Program, or COMP. This one is for new services effective July 1st, 2024. DCH proposes an amendment to the COMP waiver to add 3 new services: community residential alternative models. These will be additions to the community residential alternative model service array. Those models are specialized transitional community residential alternative, behavior focused CRA, and intensive CRA. An opportunity for public comment was held on March 27th, 2024 at noon, 12 p.m. Written comments were received on or before April 15th, 2024. DCH received one oral comment from Darcy Robb, Executive Director of the Georgia Council of Developmental Disabilities. Ms. Robb appreciated the need to improve supports for difficult situations within the comp waiver, but felt the public notice appeared to indicate that some individuals can only be supported in a CRA setting. In response, DCH wants to note that it is not the intent of the public notice or the content of the public notice to indicate that a CRA setting is the only option for difficult situations or for any specific groups of individuals within the waiver. Waiver services are brokered on assessments and medical necessity and driven by member choice of available services. Also, in oral comment, Ms. Robb felt that the unintentional incentives of the new service will be created. There will be unintentional incentives created for individuals to be retained in these services longer than desirable for themselves or the state. In response, DCH notes that services within the home and community-based waivers are broker and maintained based on medical necessity and member choice. If there is no medical necessity for the service, these intensive services, then the service would not remain an option for the member. They would choose from one of the other many services that are within the comp waiver. DCH received 3 written comments to the proposed change. They were from Cynthia Levi, the Chief Executive Officer at Avita Community Partners, Robin Garrett, the Executive Director of the Georgia Association of Community Service Boards, and a joint response from Dr. Aaron Vinowski-Thomas of the Center for Leadership and Disability at Georgia State University, Ruby Moore from the Georgia Advocacy Office, and Darcy Robb, the Executive Director of the Georgia Council on Developmental Disabilities. Ms. Levi and Ms. Garrett expressed strong support for the new services, and the department thanks the commenters for their written comments in support of the new services. Ms. Levi and Ms. Garrett expressed concern that as currently written, some of the community service boards would be excluded from delivering the service. They suggested modification to the definition to all providers to either be currently enrolled to deliver CRA service and operate at least 2 active community living support arrangements or be established as a community service board. And their reasoning for that was they noted the CSB's experience with the population within the waiver justifies the experience for being able to be one of these providers. DCH, along with the Department of Behavioral Health and Developmental Disabilities, and I want to note that we have worked in step with the Department of Behavioral Health and Developmental Disabilities on these new proposed services, considered this request and will include the recommendation of allowing CSB providers to be enrolled as a provider of these proposed CRA service as regardless of having a minimum of 2 existing CLAs due to their experience with working with the comp waiver populations. Ms. Levi and Ms. Garrett also noted concerns that the rates were insufficient for delivery of the service. They specifically noted that the rates in the rate modeling for registered behavior technicians, board certified behavioral analysts, and supervision of those services they felt were too low. DCH notes that the rates included in the rate modeling to develop the new rate models are consistent with the current rates of autism spectrum disorder therapy in our Medicaid state plan. Providing a higher rate or changing that methodology would create an inequity in the medical service delivery system within Georgia. And therefore, we will be maintaining the rates associated with that component, which is a small component of the overall rate. The joint responders in their comments recognize the need to improve the way our state supports individuals with intellectual and developmental disabilities, but noted concerns. The joint responders felt the introductory of the paragraph of the public notice proposed that an individual could only be supported by a CRA model. They felt the individuals could and should be served in their own homes. They noted a service acknowledged similar to additional residential staffing, which was already in the comp waiver, but utilized in Virginia, and another service called Community Protection Waiver in Washington State could be options to include within the waiver. They urge Georgia to set up a system that is, quote, intentionally designed to support all individuals to live in the least restrictive restrictive environments. Sorry, want to get the quote right. In response to the department would note that CRA is an integrated community service. It's an integrated community setting as outlined by the provisions of the home and community-based 1915C waiver definition and application. And it is also it is considered a community service as outlined by the home and community-based statewide transition plan. CRA in these instances is the member's home. CRA services, including the proposed new services, will be available as medically necessary and based on members' choice. The joint responders also noted concern about the cost of the service. They felt given the high cost of the service and without a codified process to transition individuals to less restrictive environments, individuals would be incentivized to remain in these new settings. DCH again notes the new services will be available as medically necessary and based on members' choice as required by the waiver. The joint responders made themselves available to help redesign the service, but did request that if DCH and DBHDD wish to move forward with the services, they strongly urge changes to the service definition, which would make it explicit that additional staffing process will be used to help people in less restrictive settings and to transition them out of the 3 new services. DCH in response notes that additional staffing as a defined service in the waiver is and will continue to be available to those individuals who through assessment are medically necessary for the services and choose that service. The joint responders requested specific time limits for the new services. DCH in response would note that services within the waiver are brokered in accordance with medical necessity through assessments and member choice. We can't really set arbitrary time frames on the waivers because like any medical service, they would continue for a period of time for which they're medically necessary and in the waivers for which member chose them. The joint responders requested that discharge planning for each service start at admission. This is not an institutional, we would respond that this is not an institutional services. It is a home and community-based service. And again, available on medical necessity and member choice. The intent is to actually divert people who are currently in institutional settings or more restricted settings to these 3 new home and community-based settings. Again, if the member could be served by another service within the waiver, and that is medically necessary and seen by assessment, they would have the opportunity to choose that other service at any time. The joint responders also requested that we incentivize transitioning to the community by using some funds to move folks into other settings. So DCH responds that CRA is a community setting already, and it's outlined by the home and community-based waiver provisions. There's not really an opportunity within the confines of the waiver to do some sort of incentivization. There are services that the individual could broker upon their choice and medical necessity. Finally, the joint responders requested that any member who receives services throughout the crisis continuum and these 3 new services receive support coordination. DCH notes that the proposed waiver amendment is specific to the comp waiver, and all members who receive comp by requirement of being in a 1915C waiver are required to receive support coordination. So everybody in the waiver already, it's a mandate, has to receive support coordination. Any member not on comp would be outside the scope of this amendment request, but DCH does appreciate that the request related to those receiving crisis services in general, and we will work with DBHDD to see how we could implement or consider that request. I will pause for any questions and will respectfully request consideration for final adoption, the comp amendment for new services.
Thank you, Brian. Are there questions or comments from the board, please, for Brian? Hearing none, is there a motion for approval for final adoption?
Dr. Lee makes a motion to approve.
Second, Hopkins.
Yeah, the motion has been made and seconded for final adoption. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, you may move to your next item.
Thanks, sir. My 7th item up for final adoption is approval of the Medicaid State Plan Amendment to Community Behavioral Health Rehabilitation Services, or CBHRS. Effective July 1st, 2024, DCH proposes to amend the Medicaid State Plan to enact the results of the 2023 rate study for CBHRS. The state plan amendment will also update the accreditation language for the Administrative Services Organization and add community health workers to the list of accepted practitioners. An opportunity for public comment was held March 20th, 2024 at 10:30 a.m. Written comments were received on or before March 27th, 2024. DCH received no oral comments. DCH received 6 written comments. The written comments were from Robin Garrett, the Executive Director of the Georgia Association of Community Service Boards, Cynthia Levi, Chief Executive Officer of Avita Community Partners, Heather Rosnier, the CEO of Bridge Health, Jade Benefield, the CEO of Pathways Center, Angela Holt, the CEO of Middle Flint Health and Wellness, and Denise Forbes, the CEO of Community Service Board of Middle Georgia. All commenters were in support of the state plan amendment and rate adjustment. Commenters noted that the state plan amendment will help address current workforce shortage issues, and they thanked Governor Kemp, the DCH Board, Georgia Legislature, DCH and DBHTD for the work and implementation of the rate study. DCH thanks the commenters and the association for their written comments and support. I will pause now for any questions and will respectfully request consideration for final adoption of the CBHRS state plan amendment.
Are there questions, comments from the board for Brian, please? Hearing none, is there an request for final adoption approval?
Motion to approve.
David Cruz has made the motion for approval. Is there a second?
Folsom, second.
Roger Folsom has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, Brian. And you may move to, I believe, your last item.
It is. My final item for consideration is for initial adoption. Pending approval by the Centers for Medicare and Medicaid Services and the Department of Community Health Board, DCH proposes to modify the state plan for Medicaid to remove dental covered procedural limitations to individuals 21 years of age and older, effective July 1st, 2024. The removal of procedural limitations will expand basic dental coverage to adults in the Medicaid and Peach Care for Kids program. The state plan amendment is consistent with budgetary instructions from the 2024 legislative session. Fiscal impact of the proposed state plan amendment for fiscal year 25 is $31,090,893 in total funds, of which $10,570,126 is state funds. An opportunity for public comment will be held May 14th, 2024 at 11:30 a.m. via Zoom audio. Individuals wishing to comment in writing on any of the proposed changes should do so on or before May 21st, 2024. I will pause for any questions and will respectfully request consideration for initial adoption of the Medicaid state plan amendment for adult dental.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption, which means it will then proceed to public comment prior to coming back as final after we've done that? Is there a motion for approval for initial adoption?
Cynthia Rucker, motion for approval.
Cynthia Ruckers has made the motion for approval. Is there a second? Dr. Hopkins has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. And Brian, thank you very much. I think one comment of all of the things that you've talked about here that is, I think, noteworthy, quite a bit of it's noteworthy, but particularly the comments that came back of hopefully these waivers will help to address some of the worker shortages out there that exist for our providers.
Yes,
So
sir.
that is, I think that's certainly worth noting and as somebody noted too, and thanking the legislature and the governor's office and so on for being able to bring this kind of approvals to the public.
Yes, sir.
Thank you. With that, we'll move on to the next area and Kim Morris will come back and talk about the items. The first is a informational update. So Kim, please proceed.
Okay, good morning again. For informational purposes, presenting the board's, the department's plan to, in accordance with House Bill 916, to update the nursing home per diem rate from the 2021 nursing home cost report to the 2022 nursing home cost report. The General Assembly appropriated total funds of $416,476,012, with state funds of $141,591,432. This update does not need approval from the Centers for Medicare and Medicaid Services, as Georgia State Plan Amendment 22-0009 allows DCH to update the nursing home Medicaid cost report annually, subject to approved budget appropriations. At this time, I will pause for any questions from the board.
Any questions, comments from the board? Hearing none. Kim, thank you very much for that update. And you may move on to your next item, which will require us to consider a vote for initial adoption.
Yes.
Go ahead.
Today, I'm presenting for initial adoption pending Medicare and Medicaid service, Medicaid service acceptance, a proposal to reimburse select primary care codes to 90% of the Medicare 2022 rates and select obstetric and gynecology codes to the 2024 Medicaid rates effective July 1, 2024. The following primary care codes will be updated. Code 99213 from $76.15 to $80.71. Code 99214 from $110.43 to $113.83. The following obstetrics and gynecology codes will be updated. Code 59400 from $2,217.89 to $2,430.54. Code 59510 from $2,459.70 to $2,707.48. Code 59610 from $2,333.54 to $2,553.24. Code 59618 from $2,491.41 to $2,737.18. Total funding for this was $33,663,348, with state funds of $11,445,538. At this time, I will pause for any questions for the board and ask the board to approve for initial adoption and increase to adjust primary care codes to 90% of Medicare 2024 rates and the OBGYN codes to the Medicare 2024 rates effective July 1, 2024.
Any questions or comments for Kim, please? Hearing none, is there a motion for approval for final adoption?
Folsom for initial adoption, Mr. Chairman.
Roger Folsom has made the motion for initial adoption approval. Is there a second?
Dr. Lee, second.
Dr. Lee has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, you may move to your next item.
Okay, the next item is pending Medicare and Medicaid services acceptance, a proposal to increase the reimbursement rate by 10% for select optometric codes. The General Assembly, House Bill 916, appropriated total funds of $1,153,453 with state funds of $392,174. The department will increase CPT codes, that's current procedure terminology codes 92004 from $90.69 to $99.76%, and CPT code 92014 from $66.56 to $73.22. Public comments will be heard on May 15th at 11:30 a.m. and written comments are due on or before May 22nd, 2024. At this time, I will pause for any questions from the board and ask the board to approve the initial adoption of a 10% increase to select optometric codes.
Is there a motion from the, or questions, comments for Kim? Hearing none, is there a motion for approval for initial adoption?
So moved, Hopkins.
Dr. Hopkins has moved for initial adoption approval. Is there a second?
Second, David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none is approved. Kim, thank you very much.
Thank you.
Next on the agenda for initial adoption consideration, call on Brian Lipton, Director of Strategic Finance.
Thank you, Mr. Chairman, and good morning to you and the board. I will be presenting 4 items here today. These items are all interconnected and were designed to work in concert with one another. As Commissioner Carlson mentioned during his opening report, the department is currently pursuing a series of updates to our state-directed payment programs, also known as DPPs. These programs have brought in more than $1 billion in additional funding for healthcare providers across the state on an annual basis. When this board approved those DPP programs 2 years ago, the shared project goals included leveraging additional federal Medicaid funding, supporting rural hospitals and bolstering rural access to care, reducing costs through appropriate level of care utilization, improving health outcomes and equity, expanding healthcare training and workforce investments. The changes proposed here today aim to further support those goals through additional funding, including significant increases to teaching hospitals in rural areas. If all components are approved by CMS as they are proposed here today, they would collectively result in more than $100 million in additional funding to hospitals across the state each year. And I apologize to delay business during this packed board agenda, but just wanted to lay that context before we dive into the technicalities behind each item. So thank you, and I'll move into my first item now. Starting with revised eligibility to the Advancing Innovation to Deliver Equity, or AID, state-directed payment programming. Pending Centers for Medicare and Medicaid Services, also known as CMS approval, the department proposes a revision to the eligibility criteria for Georgia AID effective July 1st, 2024. Eligible hospitals would be defined as hospital that is 1, an individual acute care hospital providing more than 63,000 total Medicaid inpatient days based on the 2020 Medicare cost reports and 100,000 total in-state Medicaid inpatient days as reported in the 2021 disproportionate share hospital final payment eligibility report, or 2, a non-state government-owned hospital designated as both a sole community hospital and a teaching hospital on CMS form 255210 for cost report period ending 2022. A sole community hospital is a CMS designation defined in the Social Security Act as a hospital that is located more than 35 road miles from another hospital, is the sole source of inpatient hospital services reasonably attainable to individuals who are entitled to benefits as determined by CMS based on factors such as travel time to the nearest alternative source of appropriate inpatient care, travel conditions, weather conditions, among other factors, or is located in a rural area and designated by CMS as an essential access community hospital as effective on September 30th, 1997. Aid eligibility currently includes state-owned acute care hospitals, but presently there are no hospitals in the state that meet this definition. As a result, we are also striking that language and replacing it with the designation as both a sole community hospital and a teaching hospital. The aid payments for all participants represents the difference between the aggregate provider commercial reimbursement and Medicaid payments using average commercial rates. The resulting percentage increase derived from these commercial rate equivalent calculations will be applied to all eligible participating hospitals' care management organization, CMO, claims to calculate the value-based directed payment amount. 10% of the payments will be at risk based on performance improvement of applicable quality metrics. Baseline performance metrics will be established in the first year for new providers based on established national benchmarks and consistent with the requirement for existing participants. The total estimated funding increase as a result of these changes is $152 million, with 51.6 in state funds and 100.4 million in federal funds. Please note that the state share will be funded through intergovernmental transfer. An opportunity for public comment will be held on May 15th, 2024 at 12:30 p.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before May 22nd, 2024. At this time, I would respectfully ask for the board's favorable consideration of this item for initial adoption, and we'll pause for questions.
Questions, comments from the board, please? Hearing none, is there a motion for approval for additional adoption?
So moved,
Motion for
Hopkins.
approval. Dr. Rucker.
Rucker has moved for initial adoption approval. Is there a second?
Hopkins, second.
And Dr. Hopkins has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. You may proceed to your next item.
Thank you, Mr. Chair. The next item is revised eligibility for strengthening the reinvestment of a necessary workforce in Georgia, also known as Georgia Strong. Pending CMS approval, the department proposes a revision to the eligibility criteria for the Strong State-Directed Payment Program effective July 1st, 2024. Eligible hospitals are currently defined as teaching hospitals with at least 5 resident full-time equivalents based on Schedule E, Part A, lines 10, 11, and 16 in the Medicare cost reports, excluding teaching hospitals participating in the Georgia Aid program. This change will create a 2-tier structure, adding rural teaching hospitals with between 0.1 and 4.9 FTEs, as reported on Schedule E, Part A, lines 10, 11, and 16 in the Medicare cost reports. The previous eligibility will be known as Tier 1, and this new tier will be known as Tier 2. A hospital will be considered a rural hospital if the hospital's county is not in a metropolitan statistical area as defined by the United States Office of Management and Budget, or is a county having a population of less than 50,000 according to the United States Census, provided, however, that for counties contain a military base or installation, the military personnel and their dependents living in such county shall be excluded from the total population of the county. The strong payments for Tier 2 strong hospitals represent a 75% increase to hospital Medicaid managed care base payments, which is less than the difference between 100% of commercial reimbursement and the Medicaid managed care base payments. Given the facilities participating in this program also participate in the Georgia Hospital Directed Payment Program, also known as HDPP, the final increase under the preprint will be 24.45% for inpatient care claims and 55.82% for outpatient claims, as HDPP pays 50.55% for inpatient and 19.88% for outpatient claims. There is no change to the 200% increase for to hospital Medicaid managed care base payments for Tier 1 strong hospitals. The state funding required to obtain federal participation will be funded by public hospitals for public hospitals via intergovernmental transfer and for private hospitals through provider payments. The total estimated funding increase is $13.3 million in total funds, $4.5 million in state share, and $8.8 million in federal funds. An opportunity for public comment will be held on May 15th, 2024 at 2:30 via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before May 22nd, 2024. And at this time, we'll pause for questions and respectfully ask for the board's favorable consideration of this item for initial adoption.
Questions or comments for Brian from the board, please? Hearing none, is there a motion for approval for initial adoption?
Folsom, motion for approval, Mr. Chairman.
Folsom has moved for approval. Is there a second?
Hopkins, second.
Dr. Hopkins has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, you may move ahead for your next item.
Thank you, Mr. Chair. The next item is Medicaid Care Management Organization hospital-directed payments for public hospitals rate increases. Pending CMS approval, the department proposes an increase in reimbursement for the hospital state-directed payment program for eligible public hospitals effective July 1, 2024. Eligible public hospitals are defined as all state and non-state government hospitals, excluding all critical access hospitals. The program currently provides for the aggregate difference between Medicare reimbursement and the Medicaid managed care base payment. DCH proposes an additional 10% increase on Medicaid managed care base payments for those eligible hospitals in Pool 2 of the Disproportionate Share Hospital Program, also known as DISH. Eligible hospitals in DISH Pool 1 primarily include small rural hospitals with less than 100 beds, while Pool 2 represents all other DISH eligible hospitals. DISH Pool 1 eligible hospitals receive DISH funds up to their full hospital-specific limit, or HSL. HSL is the annual limit on DISH payments to individual hospitals and is equal to the sum of the Medicaid shortfall plus the unpaid costs of care for uninsured patients for allowable inpatient and outpatient services. The remaining DISH funds are allocated proportionately to other DISH eligible hospitals in DISH Pool 2. The state funding required to obtain federal financial participation will be funded through intergovernmental transfer. The total estimated funding increase for state fiscal year 2025 is $29.7 million in total funds. That's $10.1 million in state funds and $19.6 million in federal funds. An opportunity for public comment will be held on May 16th, 2024 at 11:30 a.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before May 23rd, 2024. At this time, I will respectfully ask for the board's favorable consideration of this item for initial adoption, and we'll hold for questions.
Questions, comments from the board, please, for Brian? Hearing none, is there a motion for approval for initial adoption?
Dr. Lee makes a motion for initial approval.
Dr. Lee has made the motion for approval. Is there a second?
Second, Williamson.
Anthony Williams had seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. And Brian, you may move to your final item.
Thank you, Mr. Chair. My last item today is the same 10% increase as the last item, but will be applied to private hospitals instead of publics. As a result, I'll read a slightly abridged version of the notice. So pending CMS approval, the department proposes an increase in reimbursement for hospital state-directed payment programs for eligible private hospitals effective July 1st, 2024. Eligible private hospitals are defined as all private acute hospitals, excluding general cancer hospitals, freestanding children's hospitals, rehabilitative and psychiatric long-term acute hospitals, and rural emergency hospitals. All critical access hospitals are also excluded. The program currently provides for the aggregate difference between Medicare reimbursement and Medicaid managed care base payments. DCH proposes an additional 10% increase on the Medicaid managed care base payments for those eligible hospitals in Pool 2 of the disproportionate share hospital program. The state funding required to obtain federal financial participation will be funded through provider payments. The total estimated funding increase for this proposal is $17.9 million in total funds. That is $6.1 million in state funds and $11.8 million in federal funds. An opportunity for public comment will be held on May 16th, 2024 at 12:30 p.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before May 23rd, 2024. And for the last time today, Mr. Chairman, I will ask for your favorable consideration of this item for initial adoption and hold for any questions. Thank you for your time today.
Questions, comments for Brian? Hearing none, is there a motion for approval for initial adoption?
So move, Hopkins.
Dr. Hopkins had made the motion for approval. Is there a second?
Folsom, second.
Roger Folsom has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, and thank you very much, Brian. Next, Louis Amos, our Executive Director of the State Health Benefit Plan, will discuss some rate resolution, and we'll be asked for a vote on this as the items with the State Health Benefit Plan rates and structure are a requirement for this board to vote, and our normal oversight or advice mission, we could comment on other areas as it relates to this. So you may proceed, Louis. Thank you.
Thank you. Good morning, Chairman Boyd, members of the board, and Commissioner Carlson. The resolution that you have before you today is in accordance to the Appropriation Act for fiscal year 2025. And this is the employer contributions. I want to make sure everybody understands that the state benefit plan functions under a calendar year, January to December, but the employer contributions are pretty much set on a fiscal year starting July 1. So the request is for those library employees who are enrolled in the teacher's plan. Their current deduction, the employer deduction is $1,093. And the request is for those premiums to remain in place from July 1 through December 31, 2024. And effective January 1st, the employer contributions for the library employees will go up to $1,580. The employer contribution for the certified teachers, that amount will increase to $1,760 effective July 1. And finally, the contribution for the non-cert employees is currently at $1,195. It will continue from July 1 through December 31st at that rate, and then effective January 1, it will go to $1,580. I now pause for any questions that may come from the board and respectfully ask approval on this resolution.
Questions, comments from the board, please? Hearing none, is there a motion for approval for the resolution?
Motion for approval, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Shane Mobley, second.
Shane Mobley has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Louis, thank you very much.
Thank you, Chair, and the board for your support.
That concludes the items that will be asked for consideration for vote. This time, I'd like to call on Brandy Selvin, our Director of Government Relations, to give us an update on the recently completed legislative session. Thank you so much.
Thank you, Mr. Chairman. Good morning. We still in under the wire. Good morning, Mr. Chairman, members of the board, Commissioner Carlson. I appreciate y'all having me here this morning to provide an update on what happened over at the Capitol during this year's legislative session. I serve as the Director of the Office of Government Relations. We kind of really serve as a point on monitoring everything that's happening as new bills are introduced, evaluating any impact they could have in the department, working with our subject matter experts internally to review that legislation, and then maintain those conversations with the elected officials across the street. So it's certainly a big effort from the entire DCH team, and want to continue to express my appreciation to our staff as well as Caitlin Ward on my team, our legislative liaison, that really helps us stay on track with knowing what's happening during session. And do y'all have my presentation, Cedric? Oh, do it. First I will walk through the legislation that DCH introduced. So this is legislation that we would have submitted to the governor's office for consideration and then worked with our partners to get the bills introduced. So the first bill I was going to discuss is HB 991. This bill extends the sunset date for the hospital Medicaid financing program. This program allows DCH to draw down a federal match on the provider fees submitted by hospitals and accounts for approximately $2 billion in total Medicaid funds. The program was set to sunset on June 30th, 2025, but has been extended an additional 5 years to June 30th, 2030. HB 1078 authorizes DCH to implement a new program for dual eligible Medicare and Medicaid recipients called PACE, which stands for Program of All-Inclusive Care for the Elderly. PACE is a managed care program paid for by capitated payments to enrolled PACE organizations. PACE providers are responsible for meeting all of their members' care needs across all settings. HB 1083 extends the deadline for DCH to promulgate rules for licensure of adult residential mental health facilities from July 1st, 2023 to January 1st, 2025. As you may recall, the board approved rules for initial adoption in July of 2023. During the public comment period following initial adoption, responses were received from stakeholders that warranted additional conversation. This legislation will allow the department and the stakeholders to continue those discussions as we finalize the rules that will be presented to you for consideration. SB 456 expands access to the Central Caregiver Registry. This registry allows individuals who are privately hiring a caregiver to conduct a criminal background check on an applicant for employment. The registry is currently only available to someone hiring a caregiver for their elderly, that would be 65 or older, family member or ward. With the passage of SB 456, the registry will now be available to employers hiring a caregiver for a disabled person or a Medicaid member enrolled in structured family caregiving. SB 377 was a joint proposal between the Department of Human Services and the Department of Community Health, which enables the implementation and licensure of qualified residential treatment programs. These facilities serve children in foster care with serious emotional and/or behavioral disorders in the most appropriate and least restrictive out-of-home care setting. With the passage of this legislation, care delivered in this setting will qualify for Title IV-E and Medicaid funding. The next group of bills are bills that passed and will have an impact on the agency's operations. HB 663 places limitations on hospitals and long-term care facilities in their ability to restrict access to patients or residents by visitors or designated essential caregivers. The bill states that facilities may not limit patient access to this caregiver and lists limited exceptions to this requirement. HB 1010 increases paid parental leave for state employees and employees of local education agencies from 120 hours to 240 hours per 12-month period. HB 1335 makes changes to existing staffing requirements for personal care homes, assisted living communities, and memory care centers. For personal care homes and assisted living communities, the changes will require a minimum of 2 on-site administrators or direct care staff, require an on-site staff person to be present on each occupied floor, and allow staff to float to other areas of the building when needed, as long as defined medical alert systems are utilized. For memory care centers, the bill defines the types of direct care staff persons that are required to be on-site. HB 1339 implements broad changes to the Certificate of Need program. I will say this is a very dense 41-page bill. So my comments are going to be very high level, but so there's a lot more detail to this bill than I would be able to appropriately cover here. But you'll certainly see a lot of rule changes being brought to you for consideration as a result of the passage of this legislation. The bill directs DCH to review and update the state health plan at least every 5 years, beginning January 1st, 2025. The department must also work with the Office of Legislative Counsel to review the CON code section and make recommendations to streamline the statutory process. The bill creates the Comprehensive Health Care Coverage Commission to advise on improving access to health care for low-income and uninsured populations. HB 1339 adds additional exemptions to Certificate of Need requirements, including psychiatric and substance use disorder inpatient beds, perinatal services in rural counties, birthing centers, acute care hospitals in rural counties. A Certificate of Need will no longer be required for capital expenditures or new diagnostic imaging equipment for existing services. The bill also modifies the CON process in several ways, including reducing timelines and removal of the commissioner level review of Certificate of Need contested decisions. Finally, the rural hospital tax credit cap will be increased to $100 million per year, and the sunset of that program is extended to December 31st, 2029. Senate Bill 35 requires Medicaid coverage of continuous glucose monitors. This benefit is available to members with diabetes diagnoses who have been trained to use the monitor and either are treated with at least 1 daily administration of insulin or have a history of hypoglycemic events. And this also received some appropriations in the FY25 budget. SB 449 was a comprehensive bill to improve the ability of former military medical personnel to obtain certification or licensure in various healthcare professions. Section 1 of the bill modifies requirements around certification as a nurse aide in Georgia. The new language removes the requirement that employer-based CNA training programs in state-regulated facilities meet the same criteria as the federal CNA program. This will provide DCH increased flexibility to consider previous work experience as meeting some of the CNA training requirements, both for military medical personnel as well as other professions with relevant backgrounds. SB 505 directs DCH to develop a standardized template by December 31st of 2024 for hospitals to use when posting required financial documents to their websites. Hospitals are required to use this template and comply with reporting no later than July 1st, 2025. DCH must maintain a link on its website containing the URL for each hospital's posted documents. Finally, I will highlight some of the study committees that were adopted this year. Study committees often provide insight into legislative priorities that will be established for the upcoming session. HR 1360 creates the House Study Committee on Alternatives to Opioids for Pain Management, tasked with studying ways to enhance awareness of non-opioid alternatives for treating pain. The commissioner of DCH or their designee has a seat on this study committee. SR 323 creates the Senate Study Committee on Improving Family Caregiver Services for the purpose of examining currently available family caregiving services and identifying policy goals and legislative actions to improve upon these services. SR 476 creates the Senate Study Committee on Artificial Intelligence for the purpose of examining the current and future use of AI in the state. And finally, SR 527 creates the Senate Study Committee on Veterans' Mental Health and Housing for the purpose of evaluating the adequacy of public and private programs available in Georgia. So Mr. Chairman, members of the board, I know that was a pretty quick run through, but if y'all have any questions, I'm more than happy to answer them or follow up with any additional information y'all would like to have.
Yes, this
Thank
is
you very
Dr.
much.
Lee. How can we,
Questions or comments, please?
yes, this is Dr. Lee. How can we, request to be part of one of those studies?
I'm sorry, could you repeat that?
How can we go about becoming, a part of one of those studies?
On the study committee, so those seats are defined in the resolution, how those appointments are made. Most of those appointments are made either by the governor, the speaker of the House, or the lieutenant governor. So those are appointments that are usually defined and they would come through those appointment channels.
Okay, thank you.
So if a person wanted to volunteer in those study committees, that would be the avenue where you would make it known that you have an interest in that. Is that correct?
Certainly. So the appointments will be made, but they are public events. Typically, the chairman of these study committees are very open to public input. So we're certainly happy to share any appointments that are made if you would be interested in contacting the chair to be a participant in that conversation.
Yeah, to Brandy, it's spot on technically per the different pieces of legislation, who makes the appointments. But generally speaking, obviously, if anyone has any interest, board members especially have any interest, letting that be known to myself and Denise, we can make sure, working with Brandy, her team, it gets in front of the actual individual or individuals appointing these. So we'd be happy to act as a bit of a clearinghouse and help everyone navigate that.
Thank you, Commissioner. Thank you. Any other questions, comments, please? Hearing none, that concludes our formal agenda today. I think I'd be remiss if I didn't point out that since I've been critical in the past of the IT group here, we got through this program today without a glitch. So Cedric, thank you very much. I understand there's been a lot of testing going on, so hopefully we have those problems behind us. Does anyone know of any new business or that needs to come before the board at this time? Hearing none, the meeting is adjourned, and thank you very much for your time and patience today. Thank you.
Thank you.
Thank you.